Concerns have been raised about an increase in the use of ivermectin, an anti-parasitic medication mainly used for farm animals. It comes after a Sydney man was recently hospitalised after an overdose of the drug, which has been touted online as a treatment for COVID-19. Toxicologists warn there is no evidence to support its use to treat coronavirus. Dr. Darren Roberts is Medical Director with the New South Wales Poisons Information Centre and joins me now. Good afternoon, great to have you along. What is it?
Ivermectin is actually a medicine that is used in humans. It's a medicine that's used to kill parasites. It's available on prescription to treat various conditions in humans, but it's really only used in very specific doses, usually only once or twice. So it's a medicine that we do have experience with. It's not only for vets. The reason we're talking about it at the moment is, like you said, is that people are starting to use it for COVID, which is not actually one of the indications for using it.
So if it can be used in very specific instances where it is given by a medical professional, what sort of impact does it have if it's misused?
Yeah, so in this context, we're talking about misuse of being a dose that is higher than we'd normally see or for longer than it's usually used for. And in some cases, it relates to the fact that we're using it in someone who already has some other medical conditions. And so when this occurs, there's a risk of toxicity. The toxicity seems to be mostly based on tummy pain, vomiting, diarrhea. But we're talking about vomiting and diarrhea and abdominal pain that is so bad that people have had to present to hospital to seek care. And this is in the time when we've got such limited hospital resources and emergency departments are busy. But over in the US, we're seeing more reports of even more severe toxicity in people. And we think this probably relates in part to the doses they're taking, or maybe even the veterinary medicines. They've been having problems such as seizures, confusion. Some people have had low blood pressure. Some people have had collapses. There's been liver injury, swelling of the limbs, a whole bunch of quite concerning features, and features that really aren't necessary. People don't need to take this medicine.
Dr. Roberts, how then has it taken such hold and become, such a point of discussion?
Actually, there's been a lot of enthusiasm for the use of ivermectin since last year. It was actually Australian scientists who did work in a test tube where they found that a certain concentration of ivermectin seemed to prevent COVID from replicating. But that concentration was so high that you need to give a massive dose to humans to get an effect. But from that, there's a lot of enthusiasm. And a lot of this enthusiasm related to the fact that we didn't have vaccines back then. And so people didn't know what else to treat COVID with. They were scared, and people started taking this treatment. So most of the use that we're seeing in the enthusiasm really is in the US, where people haven't used the vaccine, or in people who haven't been vaccinated who would like to have some other treatment.
Do you see there being a correlation to social media to the uptake by some of this drug?
I think social media is having a big impact. We know that social media is generating a lot of fear with people, and we know that people are looking for answers to options of treatments that they can use. And so that's where I think a lot of people are being told ivermectin is a medicine that's available, it will prevent you from dying. But as mentioned, this is really only a question that people who are unvaccinated need to wonder about. We're actually seeing media go both directions as well, social media that is. So some are saying that it's very useful. Others are putting out fake stories about how the side effects are so severe that it's clogging up some hospital systems. So it's really quite complicated in terms of how to interpret the social media. And my suggestion is that we just need to rely on reputable sources.
Yeah, and I guess that's the key message at every instance about vaccines or dealing with COVID-19 is to get advice from your trusted medical professional, your doctor or your health centre or the like. Given that we are seeing such an uptake of social media being used as a forum around how to deal with, or presumably how to deal with COVID-19, are you seeing any other chemicals, drugs or the like getting this kind of reception?
We're seeing a lot of chemicals and other drugs and substances being used. In Australia, I don't think it's anywhere near as common as what we're seeing in the US. And I'm thinking this is because we have such good access to healthcare, but we're seeing people using chemicals, strong chemicals used for cleaning kitchens and bathrooms. They're applying it to their body. They're drinking it, they're gargling it, they're nebulizing it, they're spraying it on systems that they're using within their own health. And these are causing side effects and problems. We've seen some people actually give their medicine to their child because they were worried that the child may have COVID and this may help, without any oversight from medical professionals. And people are calling us at the Poison Centre because they're suffering from side effects, and these side effects really don't need to occur.
It strikes me that some of this must be being driven by people being so concerned and unsure about what to do. What do you say to them when they're calling your service?
We say, first of all, that you need to think about where the risk is. At the moment, for example, when it relates to using strong chemicals or cleaners on fruit and vegetables, there's been no evidence that people have contracted COVID related to that. When it comes to using chemicals on your body, really get help, really get advice as to whether or not that's necessary. It's not required, and the chemicals that are being used are associated with toxicity. So again, I would suggest that people would speak to either people like the Poison Centre to understand about toxicity, or to look at reputable sources which provide advice.
Yeah, good advice indeed. Medical Director with the New South Wales Poisons Information Centre, Dr. Darren Roberts. Thanks for your time this arvo.
Thanks very much.